And the last one of the impulse control disorders will be trichotillomania. Mary, a 20-year-old woman, is rushed to the hospital after she complains of severe abdominal pain. She appears thin and withdrawn and is missing a lot of hair from both her scalp and eyebrows. A physical exam reveals an intestinal obstruction. This, of course, is what is trichotillomania. So what's happening is that Mary becomes anxious. She pulls out her hair. Once she pulls out her hair, she feels a sense of relief. And that is what is characteristics of this disorder. It is more common in women than in men, and associated disorders could include OCD, obsessive-compulsive personality disorder, as well as depressive disorders. Usually these women will get hair from all parts of the body. Usually the first ones that get attacked would be the hair that is reachable, hair in their scalp, their eyebrows, their arms, etc. Many of them can eat their hair, so of course they can have intestinal obstructions. They also have head banging, nail biting, as well as gnawing. Now usually when you examine the scalp, what you will find is that you're going to find hairs with different lengths. You might find short hairs and you might find long hairs, and that is what helps you differentiate trichotillomania from alopecia, because alopecia, all the hair basically falls out at the same time. So you have a nice clean spot, whereas in trichotillomania that is not the case. And the treatment of trichotillomania could be behavioral modification techniques such as relaxation techniques or guided imagery, or pharmacotherapy, and probably it would be with the use of SSRIs. Now, reviewing the differentials, think of the medical reasons. Alopecia would be the biggest one, or tinea capitis. From a psychiatric point of view, we're looking at OCD as well as factitious disorder. Let's review a case. A 22-year-old woman was recently seen at her college graduation hoarding food in her purse and briefcase. When asked why, she replied, "I might be hungry later." She appeared to be of average height and weight, but with poor dentition. She has numerous calluses on both hands and fingers. Which of the following impulse control disorder is she at risk of developing? A. Trichotillomania, B. Kleptomania, C. Pathological gambling, D. Pyromania, or E. Intermittent explosive disorder. This patient appears to have bulimia, and patients with bulimia are at increased risk for B. Kleptomania. And what they typically do is that they steal food. Food, of course, which they do not need. So kleptomania would be the greatest risk that this patient would have in developing in the future.